Question 18 tests a very quick concept. It states, when is a major increase in the levels of bisphenol expected after placing a resin-based dental material in the oral cavity? So underpolymerized BPA-based monomers can end up in the oral cavity and sometimes can end up going through the body. Now, usually levels of BPA can be seen about 24 to 48 hours after they are ingested. Now, the BPA levels are usually seen in different areas of the body, specifically with regards to the kidneys when looking at urine levels and with regards to saliva samples, because the BPA is usually released with respect to the oral cavity because we're dealing with dental procedures. So the levels of BPA in the body are usually going to be consistent with the amount of teeth that are treated using resin. So the answer here is not going to be 30 days, 7 days, or 6 hours, as it is going to be between 1 and 2 days as discussed here.
So question 30 reads, which is the most common obesity-associated cancer in men? So obesity can lead to getting cancer because of multiple changes in your body and your overall health status. Option B reads gallbladder cancer. Gallbladder cancer is actually most commonly found in females instead of males. It's 3 to 4 times more often in women than in men. It develops from the malignant cells that form on the gallbladder tissue, so this is incorrect. Option C reads stomach cancer. Obesity is a risk factor for stomach and gastrointestinal cancers, but it's not the most common obesity-associated cancer in men, so this is incorrect. Option D reads prostate cancer. Prostate cancer is the most common cancer associated with men, but it's not as related to obesity, so this is incorrect. Leaving us with option A, colorectal cancer. Colorectal cancer is the most common obesity-associated cancer amongst men. It causes about 151,000 cases every year. It's caused by an overgrowth of intestinal polyps that are small and benign, but then eventually can turn into cancer if you don't remove them and treat them in time. Abdominal pain, rectal bleeding, and persistent change in your bowel habits can be symptoms of colorectal cancer. Several hormones and adipocytokines are associated with colorectal cancer and obesity, as seen in this graphic. And again, colorectal cancer being the most common obesity-associated cancer in men makes it the correct answer for this question. So question 25 reads, which patient is at a greater risk of bulimia? So bulimia, also called bulimia nervosa, is a very serious eating disorder that includes an obsessive desire to lose weight. Patients with this disorder have moments of extreme overeating, which is then followed by self-induced vomiting, abusing laxatives, or fasting. So signs and symptoms of patients who have bulimia can include sore throats, dental erosion, parotid gland sweating, and calluses on the dorsal aspect of the hand called Russell's sign, just like in this image. So Russell's sign is actually caused by repeatedly using your fingers to self-induce vomiting, and it's caused by the contact of your fingers with your teeth, which would then cause scratches on the back of your hand. So treatment for bulimia would be a combination of behavioral and pharmacological therapy. So this question is asking which patient is at a greater risk of bulimia. Option B reads a 15-year-old male. So while anyone is at risk, this is not the most common demographic, so this would be incorrect. Option C reads 45-year-old male. While it is mostly seen in women, the older demographic of females is not the most common, so this is incorrect. Option D reads 45-year-old male, which is not the most common demographic, so this is incorrect, leaving us with option A, 15-year-old female. So the most common demographic for bulimia is young women, usually teenagers or women in their younger 20s, so this would be the correct answer for this question. So question 12 asks, which is an appropriate HbA1c value for this patient's dental treatment? Here we have a 70-year-old male. His chief complaint is my broken tooth hurts every night. His background and patient history is hypertension and type 2 diabetes. His current findings are an upper right canine fractured at the gum line with large apical radiolucency present. So immediately we see he's a type 2 diabetic. We're expecting to see an HbA1c over 6.5. So HbA1c is a blood test that we use to measure glycosylated hemoglobin. It measures the overall glycemic control of a patient in a 3-month period. It's used with serum blood glucose levels to diagnose diabetes mellitus, so it's important to remember these ranges. An HbA1c level of less than 5.7 is normal. A level of 5.7 to 6.4 is pre-diabetic, and an HbA1c level over 6.5 is diagnostic of diabetes. It's normal for a diabetic patient to have that level of 7 to 8 when performing dental treatment, but if a patient has an HbA1c over 8, it represents poor diabetic control and we can't continue with invasive dental treatment. Because we'll see things like poor wound healing, gingivitis, periodontitis, and high infection risk. So looking at our options, option B reads 9, which is above 8 and is way too high for dental treatment. So this would be incorrect. Next is option C, which is 10, again, way higher than the safe range for diabetic patients, which we mentioned is 7 to 8. So this would be incorrect. Next is option D, which is 12. Again, way too high, so this is incorrect, and leaving us with option A, which is 7. This is within the safe range for diabetic patients. This patient, again, is a type 2 diabetic, so the safe range is 7 to 8, so this is the correct answer. So question 5 reads, what is the most common likely diagnosis? Here we have a patient box. We have a 75-year-old female patient. Her chief complaint is, I have burning sores under my denture. Her background and patient history says, upper denture inserted 3 days ago. A cast removable upper denture design involves a single palatal strap as the major connector. And her current findings are a fiery red ulcerations on hard palate under major connector of denture, and pressure indicating pace does not reveal any interference. Okay, so option B reads overextended flanges. Overextended flanges of an upper denture would not show us red sore spots on the hard palate. Instead, it would show us sore spots on the vestibule or on the labral frenulum, or present as a loose denture during function, or even gagging issues or speech issues, or even difficulty swallowing. So none of this is seen in the patient, so that would make this incorrect. Option C reads normal reaction to denture wear. A normal reaction to a denture might be discomfort at first, but red ulcerations on the palate and pain are not normal, so this would be incorrect. Option D reads high spots on the denture major connector. So considering pressure indicating pace was used and it did not reveal any interferences, this is incorrect. Now, if there were high spots on the denture, the pressure indicator pace would have revealed them. So this leaves us with option A, nickel allergy. So the patient is complaining of burning sores, and they are fiery red ulcerations on her hard palate. This is contact dermatitis. It's a delayed hypersensitivity that happens around 12 to 72 hours after being exposed to the allergen. So this is relevant considering the ulcerations are at the location where the metal component of the major connector are touching the soft tissue, and she was given the denture 3 days ago. So it's important that you know the clinical presentation of contact stomatitis, and that includes erythema, edema, ulcerations, and leukoplakia-like lesions. So also watch out for patients complaining of burning pain where the suspected allergen is contacting the soft tissue. So wrapping it all up, option A is the correct answer.
Question 40 states, which organization is responsible for the storing, transporting, and disposal of mercury? So let's go through the different answer choices. The EPA is the United States Environmental Protection Agency, and they are going to be important for protecting individuals and the environment, which is what the question is asking us about here. Looking at the FDA is relevant for food, drugs, and cosmetics and protecting consumers. So this would not be relevant to the question here, so we can cross it off. Next, we have the ADA, the American Dental Association. This will be relevant to promoting oral health in the communities and relevant to dentists and the provide that they care. This will not be specific to the storing, transporting, and disposal of mercury, therefore we can cross this off the list. D states the World Health Organization. The World Health Organization is there to promote the health of individuals in the world. They look at trends in disease and health more holistically, and so this is not going to be specific to the storing, transporting, and disposal of something like mercury. Therefore, we can cross off D. So we're looking at A, the EPA, as the correct answer choice here.
So question 18 reads, a 45-year-old patient with a known history of head trauma after a motor vehicle accident 3 days ago suddenly falls into an arched position. The dentist notices an abrupt spasm of all the body muscles followed by sudden shaking. The dentist also notices increased salivation and tongue biting. The patient's blood pressure is now 160/95 and he's tachycardic. What is the best next step? So, because the patient had a recent motor vehicle accident, that actually makes him more at risk of a seizure, which is actually what is happening in this scenario. We know that because of the spasm of the body muscles, the shaking, the increased salivation, and the tongue biting. So, what's the best thing to do? Option A reads, administer oxygen via nasal cannula. So you would do this after the seizure is done, but right now we're looking to see what to do while the seizure is taking place. So this is incorrect. Option C reads, suction oral cavity. So again, you do this after the seizure is done because it helps prevent choking on the saliva, but this is incorrect. Option D reads, notify emergency medical services. So you would do this if the patient stops responding completely or doesn't have a pulse, so this is incorrect. Leaving us with option B, place the patient in a supine position. So the best thing to do if your patient is having a seizure is place them in a comfortable position, like a supine position, so that they don't injure themselves, making this the correct answer for this question.
Before a sterilizer can be returned to surface, how many consecutive cycles should it generate negative test results for? Items that are generally sterilized are critical items as well as semi-critical items, and these are instruments that generate Before a sterilizer can be returned to surface, how many consecutive cycles should it generate negative test results for? Items that are generally sterilized are critical items as well as semi-critical items, and these are instruments that generate the highest risk of transmission of bloodborne diseases. Critical items are those that absolutely need to be sterilized, and those are those that penetrate skin or mucous membranes, and this includes instruments such as scalpels, forceps, and even scalers. Today, sterilization usually occurs through heat sterilization, and there are several factors that can prevent successful sterilization, causing it to be taken out of service. So this means that there should be regular assessments of sterilization efficiency, and if proven to be less than adequate, then the sterilizer should be taken out of service, as I said. So we can check if sterilizers are functioning properly through a variety of means, such as mechanical indicators, chemical indicators, as well as biological indicators. If any one of these indicators show that the sterilizer has failed to perform its task, then it has to be taken out of function until the problem has been resolved. If there's a biological error, then the sterilizer needs to generate 3 negative results, making B our correct answer. In addition, we have to reprocess all instruments that have been processed since the last positive spore test. So option A reads 2, and this answer is incorrect, as we need to have 3 negative test results in order to bring the sterilizer back into service. Option C reads 5, and this answer is incorrect, as we do not need to have that many consecutive cycles of negative test results before the sterilizer is returned to service. Option D is also incorrect for the same reason. We do not need to have 8 consecutive cycles, we only need 3, as we can see.
Question 29 reads, after repositioning, what is the appropriate length of time to splint the central incisor? Here we have a 29-year-old male patient. His chief complaint is, I fell in the shower and hit my face. His current findings are an upper right central incisor, shows mobility and bleeding. Periapical x-ray and clinical exam shows lateral luxation of central incisor. So luxation is dislodgement of the tooth from its alveolus without complete avulsion. Lateral luxation is displacement of the tooth from the socket in a direction that's not axial. It's one of the most severe dental traumas. It involves things like bleeding, contusion, separation of the periodontal ligament, and alveolar fracture. Recommended treatment is splinting to allow stabilization of the surrounding dental structures to heal, and it's also really important that you monitor with follow-up appointments and clinical and radiographic evaluation. So, this question is asking us, how long do we splint a laterally luxated central incisor? Option A reads 2 weeks. 2 weeks is recommended for avulsion, extrusive luxation, and subluxation, but not lateral luxation, so this is incorrect. Option C reads 4 months. 4 months is recommended for repositioning a tooth with a fracture of the cervical third of the root, but not lateral luxation, so this is incorrect. Option D reads 6 months. This is not a splinting time for any case, so this would be incorrect, leaving us with option B, which is 4 weeks. This is the recommended treatment for lateral luxation.
So question 6 here is similar to another question we previously discussed, as it highlights the OSHA and its requirements for various vaccinations. So the question here states, which vaccination for healthcare personnel is regulated by the Occupational Safety and Health Administration, or OSHA? And the different answer choices here include vaccinations for various diseases. Now, it's important to distinguish between state laws and the OSHA requirements. Certain states may require individuals within various workplace settings, including dentistry, to have certain vaccinations completed. The OSHA, however, requires that individuals have something specific to hepatitis B. Now, it's important that employers offer and cover the cost of hepatitis B vaccination within 10 days of their start of work. Now, if an individual chooses not to receive this vaccination, it's important that this individual completes the mandatory OSHA declination form to ensure that they understand the risks involved with the practice that they are partaking in, and they understand the risks of hepatitis B. So that leaves us with all other answer choices here except for A as incorrect, as the seasonal influenza vaccination, measles live virus vaccination, and COVID-19 vaccinations are not requirements according to the OSHA, as the OSHA does require individuals to have the hepatitis B virus vaccination or to at least have their mandatory OSHA declination form completed.
The patient reports that their extremities feel tingly but feels no pain upon beginning the procedure when gently shaking their shoulder to elicit a response. Which level of sedation describes this situation? So taking a look at the patient box, we can see that we have a 21-year-old female whose chief complaint is that she wants her wisdom teeth out. She does present with generalized anxiety disorder, and we can see that her third molars are planned for extraction with the use of nitrous oxide and midazolam, likely due to the anxiety. And it is important to understand the various levels of sedation that we have listed here, and typically these levels of sedation change depending on the route of administration as well as the sedative agent used. And we can tell what level of sedation they are in through the level of responsiveness, whether airway intervention is required, the presence of spontaneous ventilation, as well as whether there is adequate cardiovascular function or not. As nitrous oxide is capable of producing all these stages of sedation, we have to be aware of what each stage entails so that we know when we are bringing the patient to the appropriate level of sedation. Let's take a look at our options, and in minimal sedation, patients are able to respond normally to any verbal and tactile stimuli with slight impairment in cognitive and physical coordination. There is generally no effect on spontaneous ventilation or cardiovascular functions in patients who are receiving minimal sedation. So because this patient here does not seem to be having any issues with ventilation or cardiovascular function, we might suspect that she is under minimal sedation, but this does not necessarily mean that she is. We also have to consider how she responds to tactile stimuli, so the shaking of the shoulder. She is unable to respond to it normally, meaning that this answer is incorrect. Option B reads moderate sedation, and what we are looking for in this level of sedation is still a response to visual and tactile stimuli, but it might be a little bit altered, so not the same level as if the patient was fully conscious or just under minimal sedation. And this is our correct answer, as we can see here that the patient does not feel pain, and we need to shake her shoulder in order to get a response. So other signs to look out for in those with moderate sedation are adequate spontaneous ventilation and cardiovascular function, so those aren't impaired in these patients. And we also have to look out for whether they are able to communicate their pain level during the procedure, and if they are able to do so, this is indicative of moderate sedation as well, and we do see that the patient is able to communicate that she's feeling no pain. Option C reads deep sedation, and we know that this answer is incorrect because a patient in deep sedation will need a repeated or painful stimuli in order to elicit a response, but we see here that the patient does not need that. In addition, these patients will have a compromised spontaneous ventilation, so the practitioner may need to intervene with airway function. However, cardiovascular function is still maintained. Option D reads general anesthesia, and this is when sedation is so severe that patients are unresponsive to even painful stimuli. Under general anesthesia or general sedation, patients are undergoing a drug-induced loss of consciousness, and patients also have a compromised spontaneous ventilation and cardiovascular function, so airway interventions are needed. We have to keep in mind that it is difficult to keep patients sedated in their appropriate levels, so it is important that dentists are able to recognize the different stages and how to resolve emergency situations. General guidelines state that minimal sedation requires at least further training or a BLS or basic life support certification. For moderate sedation, dentists are required to have comprehensive or advanced education and basic life support or advanced cardiac life support training. And then for deep sedation and general anesthesia, practitioners are required to have advanced education as well as a basic life support or advanced cardiac life support training.